We're joined by Dr. Jenny Franke, the Chief Medical Officer at Mercy Health in Kentucky. Dr. Franke, I want to thank you so much for joining us this evening. And if I may, to get us started here, I mean, the numbers COVID-wise in Kentucky, we're just seeing an influx of cases, especially after the Labor Day weekend. What goes through your mind when you hear those numbers coming through?
Yeah, Julie, it's a tough situation that we're in. I mean, it's very worrisome. In many respects, it's very sad because we just keep seeing the numbers climbing, and our resources can't really meet the need at this point in time. When Kentucky is part of national media coverage regarding COVID, you know that things are very worrisome. If you look at the region, maybe 3 or 4 weeks ago, we know that Southeast Missouri and Arkansas were really hotspots of COVID, and that's gradually moved its way east.
Why do you think that may be, that Kentucky is all of a sudden kind of reporting more and more cases?
Well, we clearly see that states where there's a higher vaccine rate are better protected. We've tried very hard to educate the public and increase access to vaccines in Kentucky, but we're still lagging behind there. So I think that's part of it. Part of it is just that regional spread from one hot spot to the other. Western Kentucky is dealing with a lot of COVID right now, and I think that's spreading towards Eastern Kentucky and Tennessee. Certainly it looks like a wave of transmission going across the country.
Definitely. And are you seeing, may I ask, an influx of patients coming to, Mercy Health?
Yes, we're seeing a very high census in the hospital in general, and then seeing a really sustained high level of COVID patients the last 2 or 3 weeks. Our critical care has been at 92 to 100% capacity over those 2 weeks. And so when we're at 100% critical care capacity, that means that we really don't have the ability to accept transfers from smaller hospitals or do higher acuity surgery here at Lourdes, just because we don't have any critical care beds or staff available.
May I ask, what has that meant for your staff? How are they coping with the influx of patients coming in?
It's very difficult. We've been dealing with this for a year and a half. They are weary, they are tired. I will say that we have a tremendous team here at Lourdes, and what we have is a spirit of working together, trying to support each other's resilience, knowing that tomorrow we're going to come back to work and try to make a difference. So the teams are tired, but they're still doing an excellent job.
And we're hearing a lot about treatments for, COVID-19 patients, including monoclonal antibody treatments or infusions. Is that something that Mercy Health is equipped to, treat patients with?
It is. That's a great question. The two settings in which we infuse monoclonal antibodies are the emergency department. So if somebody comes to the ER with COVID symptoms, they're tested and they're positive, and we're concerned, they're kind of on the fence. They're clearly sick enough to be in the ER, but not sick enough to be in the hospital. We want to make certain that we're able to improve their symptoms and help keep them out of the hospital. Infusing those folks with monoclonal antibody in the ER is an option. I'll be honest with you, in the middle of a pandemic, our ERs are very full, and it's very difficult to allocate resources in an emergency department for an infusion that's going to take up to an hour and then an hour of observation after that. What we've done instead, that I think is a really good option, is we've expanded a clinic that is solely for monoclonal antibody infusion. So folks are identified either in the ED or in drive-through testing, or been tested by their primary care doctor, and they meet the criteria for monoclonal antibody infusion. Their doctors are able to call, get them in quickly. We do the infusion in a setting where nurses who are very specialized in various types of infusion are there. They're on site. They're able to be monitored afterwards. And we've really had great success with that program. We can do up to 20 a day, Monday through Friday in that clinic right now.
Wow, that is innovative, if I may say so. And you know, right now in Kentucky, there's a bill to kind of push back against, you know, any possible statewide mask mandates, and the same goes for schools. You know, as a healthcare professional, do you think mask mandates or, you know, mask requirements are an appropriate step at this point in the pandemic?
Well, I'm speaking as a physician and not as a politician. My focus is always going to be the health and wellness of the community. I think it's very clear at this point in time that masking helps prevent the transmission of disease. We are in a pandemic right now in Kentucky. Things are getting worse. They're not improving. And I think a mask mandate in areas where people are going to be gathered indoors is very, very appropriate. I'm worried that in the political realm, there are other pressures, other factors that are playing a role here. But from purely a public health standpoint, masking works, and it's simple. Most of our kids are now educated on masks. Oftentimes I'll have one of my grandchildren remind the other one to put his mask all the way over his nose. So it's just part of their life now. I think masking is very important.
All right, Dr. Franke, I want to thank you so much for joining us for our COVID conversation. We will have this entire interview as well as more COVID-19 information on our website, WSILTV.com. We'll be right back after this.